Name for the record, your position on the bill, and you have 2 minutes.
Thank you, Madam Chair, Senators. I'm Steve Wohleb. I'm here on behalf of the Texas Hospital Association, as well as the Texas Public Health Coalition, an organization consisting of more than 30 healthcare professional organizations and health-focused organizations dedicated to disease prevention and health promotion, to testify against Senate Bill 1669. We're extremely concerned with how sweeping the bill is in terms of limiting a hospital's ability to curtail the spread of disease in its facilities and ensure the availability of its workforce when a contagion is or threatens to become rampant in a community. Vaccines do both, and this bill would prohibit the use of what may be the most effective tool a hospital has available to it the next time the healthcare system is threatened with collapse by an out-of-control disease. And we urge you to guard against viewing this bill specifically in the context of the COVID-19 pandemic. COVID-19 is being brought under control, as we know, largely due to vaccines, I would add. But we may not be so lucky with the next novel disease, and vaccines may be the most effective strategy for bringing that disease under control. It is therefore critical that we view this type of public health policy in the broadest context possible, and not just through the lens of a pandemic that's finally, after more than a year, receding. Texas has for a decade now, under Chapter 224, endorsed the notion that healthcare facilities can mandate vaccines for their employees. This is sound policy that's worked well and left ample room for accommodations based on reasons of conscience, including a religious belief. Just as we all as individuals must decide for ourselves what the best strategy is for staying healthy, hospitals should have the ability to adopt policies that are best suited to serve the needs and circumstances of their patients, their workforce, their communities, and the public health environment they operate in. Finally, with regard to the broader public health issue implicated by this bill, disease outbreaks often have to be fought on multiple fronts, as we were recently reminded. Yet this bill would impose an inflexible, all-encompassing, one-size-fits-all approach, prohibiting vaccine mandates. Vaccines work. Diseases once feared by our parents and grandparents have been wiped off the face of the earth through the widespread use of effective vaccines, and we believe mandating mandates uniformly.
Thank you so much. We have your
Thank you.
position registered, and thank you for your testimony. Senator Hall, but Senator Hall, excuse me 1 minute. Steve, if you'll hold. The chair wants to go ahead and ask Victoria Rios, Pamela Davis Court, and Jennifer Bridges to come down and be ready for testimony next. If you're up in the gallery, please come down. Go ahead, Senator Hall.
Thank you, Madam Chair. This bill really isn't about the vaccines or whether they're effective or not, or whether they work or not. This is about liberty, but it's really about an employer requiring a medical procedure that is irreversible. So that being the case, and that's what you want to do as a hospital, that you think you have to do to be able to operate your hospital, is to require this person to get an irreversible medical procedure in which no one that's involved in it has any responsibility for it. The manufacturer has no responsibility. The administrator of the procedure has no responsibility. So why should the hospital not be responsible for any adverse effect to the person being required?
Yes, sir. Thank you for the question. I think I would just clarify what the hospital wants to be able to do as it relates to this bill is to be able to make that judgment. What is the best thing for its patients and for its workforce in response to something like a COVID-19 pandemic? There is compensation available both for this vaccine as well as any FDA-approved vaccine, and those programs work. In my experience as an attorney, my personal experience as an attorney, those programs work. So I think that's one point that needs to be made and emphasized. It's not the case that there is no recourse for injuries caused by this vaccine or any other vaccine. But in the end, we are just requesting that that the legislature not take away the hospital's ability to make that judgment, to take all the factors into consideration related to the safety of the vaccine, as well as what is the best policy for its patients and its workforce in response to something like a COVID pandemic.
Okay, just an easy yes or no question. Should not the hospital that's requiring this be done assume the responsibility for any adverse effect to the person that they're requiring it to be done to?
In my judgment, Senator, no. they shouldn't. I don't think they should have to
Okay.
be put in the position of making the judgment and making the choice between protecting their patients and their workforce and incurring this legal responsibility.
Made that choice himself, but thank you. I was hoping for an answer.
Thank you, Senator Hall. Thank you, Mr. Wohleb.
Thank you.
Thank you so much. The chair now calls up